always very informative. Thank you so much for joining us today. Welcome, Dr. Barrows.
Well,
hello.
There we go. Thank you for having me, Cheryl. I'm always pleased to be talking with you, and I'm looking forward to visiting and sharing about acupuncture with everyone. So, everyone, thank you for joining me. Many people are familiar with acupuncture, but they're not too sure about whether they want to try it or not. So I want to talk to you today about the life-changing benefits of acupuncture and herbs, a few of the herbs. There's many, many herbs, and so we're only going to scratch the surface. But some of these you will be familiar with, so we're going to talk about that today. But first I want to share with you about what is Chinese medicine. It was developed in China thousands of years ago, and there are a number of things that Chinese medicine covers, not just acupuncture. It's just that acupuncture we're most familiar with. There's herbal medicine, there's cupping. A lot of people are familiar with cupping after the Olympics a few years ago, and you saw maybe some circles on some of the swimmers and athletes. There is Tuina, or clinical Chinese massage, Gua Sha, which helps people. Sometimes it's used on children, and it helps with colds and flu. There's moxibustion, which is using herbs to heat up a certain area. It's a burning of an herb. And then there's Qigong, and Qigong helps to move energy by exercise. So those are some of the modalities that fall into the traditional Chinese medicine umbrella. Acupuncture is a medical protocol that's focused on correcting imbalances of the body overall. And from its inception in China over 2,000 years ago, acupuncture has been used to not only treat disease, but to prevent disease as well as to improve health. So what is acupuncture? Often when we talk about acupuncture, it is that people know about it as needles, but we have an impression in our mind of needles that are big, like when we get shots. And the acupuncture needles are very small, very thin, sterile needles, and we put them in certain points of the body, and it improves and stimulates the movement of qi and blood. That is the movement of energy. And sometimes you will feel numbness, heaviness, tingling, but at the site of the acupuncture point, there is no pain. In fact, your acupuncturist will adjust a needle so that if you are feeling any kind of unusual sensations, then the acupuncturist will adjust that. So no pain is involved. So how does it work? Well, I personally find acupuncture to be a beautiful, beautiful healing modality. The traditional explanation for acupuncture is that it modifies or moves the flow of energy. And we know where energy flows, blood will follow. And we all know that if you have blood flow to an area, that it will actually increase healing. So I love cartoons, and this one makes me laugh because I really think this is how people end up at an acupuncturist. And sometimes people end up in health food stores or to a chiropractor or a number of different alternative healings. But I love this one. It says, we've exhausted all conventional measures. One last desperate option is to put you on an alternative natural medicine that is a 96% success rate. And that's what I feel about acupuncture. We have a very high success rate, and I feel like that's how we see patients. They've exhausted other possibilities, and so they come to see us. And I feel we're very fortunate in that way because we get to see some wonderful people. The goal of acupuncture is to promote and restore the balance of energy. So not only are we addressing a certain illness or dis-ease in the body, we are working on balancing the energy throughout the body. So often we will have healing and benefits in other parts of the body than what you may have come in to see the acupuncturist for. And that's always good. Most people, when they come in to see their acupuncturist, they get up off the table and they're like, wow, that was so relaxing. I really enjoyed it. And I always smile because that's how I experience it. It's very relaxing for me. The potential benefits of acupuncture when it's done correctly is that it's very safe. There's very few side effects, and it's an effective treatment. It can be used alone or as an adjunct with other modalities, with also Western medicine. It's very, very effective in controlling pain, and that's the number one thing that most often, I shouldn't say number one, but most often acupuncturists will see people for pain. And it's also useful for patients that don't respond well to medications. So here's just a few, and I say just a few. There's a handful on this. It's acupuncture is going to help with relieving stress and anxiety, helps in managing weight. Not a quick fix, not the magic bullet that everybody's looking for, but it helps with management of healthy weight. It aids in treating insomnia, gives relief from nausea and vomiting, helps reduce heartburn and indigestion, and oh, there's so many people that have that. It's helpful for treating migraines, neck pain, provides relief from chronic pain, arthritis, pain, and it aids in improving vision, hormonal balances, fertility, and erectile dysfunction. So chronic pain. This is a hard one to treat. In fact, medical doctors often don't really know how to treat chronic pain. The standard of care for chronic pain is often heavy narcotics. And we know in this day and age that with the opioid epidemic that that's not the route that people need to take. So for chronic pain, acupuncture is very beneficial. A study in the Archive of Internal Medicine has shown acupuncture to reduce pain up to 15% when used for a variety of different types of pain. But primarily it focuses on chronic pain, pain from stress, poor sleeping habits, and old injuries, tightness of muscles, pregnancy, and the list goes on. But these are some top things that we often see. Arthritis. Arthritis can be absolutely debilitating, and it affects tens of millions of people around the world. Often, what acupuncture will do is to reduce the pain itself and can reduce the inflammation associated with arthritis. Migraines, headaches, and neck pain. So many people come into the clinics and they have one of these. Migraines, which can be debilitating, especially during the season changes, weather changes, headaches overall from stress, or neck pain. We're in the technological time period in the world, and neck pain with people looking down, sitting on the computers, having the phone in their hand, often we see neck pain. And acupuncture has been able to give relief for migraines and neck pain. Not only the pain relief, but how often the frequency people are having neck pain or headaches. In a 2011 review, there was nearly a unanimous supportive proof of acupuncture being a reliable and side effect-free way to relieve constant neck pain. Again, another cartoon. I can't help myself. This one is how I think people envision things. They're often surprised, as you see here, early acupuncture, and they're throwing spears into this mammoth's hind end, and all of a sudden the neck feels better. And that's the way acupuncture is. Acupuncturists may put a needle in the foot or in the shin, and it helps with shoulder pain, or they put it in the hand, and it helps with the neck pain. So acupuncture, when people have needles put in certain places and they go, wait a minute, that another part of my body feels better. So I absolutely love this cartoon. Anxiety. Oh, there's so many people experiencing anxiety. And sometimes it's from the stress of the holiday season. Sometimes it's stress from our job, school, home life. But studies have shown that acupuncture helps with anxiety in a number of ways: generalized anxiety disorder, anxiety neurosis, and perioperative anxiety. And the clinical trials have shown that there is a positive correlation between anxiety reduction and acupuncture. Like I said earlier, people get off of the table and they say, wow, I feel so much better. And that helps, even for that short period of time, reducing anxiety and reducing what people are experiencing. So very good for anxiety. Insomnia. Studies have shown that acupuncture can reduce the frequency of insomnia for many people, and that it shows that it increases the secretion of nocturnal melatonin. And a study has shown that in less than 5 weeks, regular acupuncture is significantly decreased the presence and effects of insomnia in this particular test study group. People do come in, and insomnia can be for a number of reasons. It can be due to pain. It can be due to anxiety. But acupuncture is very good for treating insomnia. Heartburn and indigestion. And this right here is a model that shows some points that are utilized for heartburn and indigestion. And regular acupuncture therapy has been used to reduce the signs of indigestion, heartburn, and they don't have to take as many antacids. Facial rejuvenation. We're all looking to feel better and to look younger. And acupuncture, one of the benefits is facial rejuvenation. And you can have acupuncture in various parts of your body, and there's also acupuncture for the face. Very small needles are used, but again, when we talk about the movement of qi and blood, when you increase the energy and the blood flow into the skin, it's going to help lift. So it works naturally, and again, no toxic side effects whatsoever. Increases the collagen and increases the tone in the facial muscles. There are a number of other treatments that acupuncture is beneficial for issues: quitting smoking, improved vision, weight loss, hormonal balance, fertility. There is a protocol called the NADA protocol that is beneficial for stopping smoking or for treatment of detoxification from drugs and alcohol as well. So acupuncture has been used in a number of ways, and you can see on the screen here, these are the 5 points for the NADA protocol. And sometimes people will be using the NADA protocol, and that will be the only acupuncture that they have for treatment. Detoxification. Again, another cartoon. Often when we talk about weight loss, people have images of acupuncture needles going in a variety of places. And this one caught my attention because that's kind of, if you don't know about acupuncture, that's what we think. Well, what are you going to do? Where are you going to put the needles? And so tell me more about the acupuncture diet. Does it really work? And that's a question that we get quite often. What are you doing? How are you going to do it? Where's it going to be? So for acupuncture to treat weight loss, no, we don't put them in your tongue. So what to expect when you come in to see an acupuncturist? Well, first of all, you're going to have a comprehensive interview and a consultation with the acupuncturist. And they're going to ask a number of different questions about things that you may not have even thought about and how it's going to make you feel better. They may look at your tongue, they'll feel your pulse, and they're going to ask you a number of different questions, perhaps about your bowel habits, your diet, your sleep, your menstrual cycle. And after they have done a very thorough consultation, they will be more readily able to address treatment that is specifically for you. Not everybody. This is not a one-size-fits-all medicine. This medicine, acupuncture, is designed for every individual so that we are able to treat specifically what the patient is needing at that time. So what's the treatment like? That's the question that we get all the time. Acupuncture needles are going to be inserted into a number of places depending upon what you need. They may go in just very shallow, or it may be a little bit deeper. The needles are left in place for 5 minutes to 20 minutes, sometimes a little bit longer. And you may need 4 to 10 treatments. People are all different. As I said, this is a very unique medicine, and if you've had a chronic issue, then you're going to have a longer treatment. But acute issues sometimes can be treated in as little as 2 to 4 treatments. So this is a picture, a slide that will show you the size of the needle. An acupuncture needle is 0.25 millimeters for the most part. Now, you can see the sewing needle, which is larger, the medical syringe, and I want to let you know that the medical syringe, you can fit 10 acupuncture needles into one medical syringe. So they're very small, about the size of a cat's whisker, if you will. And then, of course, the matchstick. So we know how small the matchstick is. The acupuncture needles, often what you feel is the guide tube that's actually placed on the skin so that really don't feel the needle itself. And first-time visitors often come in and you can see the butterfly on the left. And the other one, say, relax, it's just a little acupuncture. And that's often what people experience when they come in and they've been on the table. They feel like once they've tried it, oh, that wasn't so bad after all. And I like it. It makes me feel better. And so, again, a cartoon. Thanks for indulging in my enjoyment of cartoons. So acupuncture from a Western perspective. Because acupuncture is so effective, the question is often asked by the medical professionals, so how does it work? So from a Western perspective, it's going to release endorphins and enkephalins. It's going to support neurotransmitter balance, serotonin, GABA, norepinephrine, and dopamine. It increases the cerebral and local blood flow, as well as decreasing inflammation. This is a great slide. I absolutely love the image here. So Eastern and Western philosophies are different, and yet they can work together to have a healing approach. But the Western medicine often looks at the body as a machine. Health means that there's absence of disease, functioning within normative parameters. The outlook of medicine is that we are going to have a war on disease and that doctors are going to address it, and there's very often a standard of care for that particular issue. The Eastern philosophy is that the body is a garden, and I love that analogy and that metaphor. Health is integrity, adaptability, and continuity. The outlook of medicine is to cultivate health with the doctor and have a partnership between the doctor and the patient. It's to improve not only the personal conditions, but also improve the ecological conditions that the person is in. So how do you interact with your environment? To give you an example, when we talk about the body as a garden and when we talk about the chi flow with the body, any of you that have done gardening, you know that you have rows in a garden. And if those rows are blocked, let's say leaves or detritus get into those rows and water can't flow there and nutrients can't flow there, the plants will die or they will be smaller than what the other plants are. But if you clear out that row and that pathway, then the water and the nutrients are going to flow to those plants. The body is very much like that, and that is the approach that Eastern medicine and Eastern philosophy take, is that the body is a garden, and ideally we want all of the chi in the blood to flow into all of your organs. The World Health Organization published a report in 2003 on a variety of diseases and symptoms or conditions that acupuncture has been proven through controlled trials to be an effective treatment. Adverse reactions to chemotherapy or radiation, and often oncologists will have a patient working with their acupuncturist to help reduce some of the side effects. Allergic rhinitis, in other terms, allergies, biliary colic, depression, dysentery, dysmenorrhea, facial pain, headache, hypertension, hypotension, induction of labor, low back pain, morning sickness, as we talked about, neck pain, rheumatoid arthritis, knee pain, stroke is something that we also are very good at, the acupuncturist. Neuro-Acupuncture is very good for stroke. TMJ, often people have a lot of pain from TMJ, very good for helping that. There were more than 100 indications were discussed and divided into 4 groups, and there is a full list. I have it here on this screen. You can come back to this. It's for www.evidencebasedacupuncture.org, and then the WHO official position. There is also, people are always concerned about, is there a safety? Is there anybody that's watching over the acupuncturist? And there is a governing body, the National Certification Commission for Acupuncture and Oriental Medicine, NCCAOM. And if you do ever have any questions, you can call the American Association of Acupuncture and Oriental Medicine at 866-455-7999. So let's talk a little bit about herbal medicine and how acupuncture works with herbal medicine. Herbal medicine is important because it helps the acupuncture. While acupuncture is incredibly effective on its own, herbal medicine is a synergistic modality that helps people to continue the benefits of acupuncture. Herbal medicine, from a Chinese perspective, is naturally occurring substances to enhance one's health and vitality. They are made from minerals, animals, insects, plants, roots, barks, leaves, flowers, berries, and there's little or no side effects involved with these herbs and are very safe and effective with the other medications that a person may be taking. So I'm going to talk about, as I said, just a few, and these are some that you may be familiar with. Andrographis, and andrographis, the Western term and scientific name is Andrographis paniculata. The Eastern name is Chuan Jin Lian, and andrographis from a Western perspective is the king of bitters. It is a very bitter herb. It's been used as an antibacterial, antiviral, inflammatory, anti-inflammatory, and it supports the immune system. It's cardioprotective, and it helps with upper respiratory tract infections, and that's often what you'll hear about it from a Western perspective. It's also one of the best liver protectors, and studies have shown that it can outperform milk thistle. If you are looking for a andrographis, you want to make sure that you look for andrographis that's standardized to at least 80 milligrams of andrographylide, and that's one that you can find in Western stores and channels. The Eastern perspective, as I said, Chuan Jin Liang, it falls in the category of clear heat and relieve toxicity. Well, if we look back over at the Western perspective, that's what it's doing. It's clearing heat. When we have a upper respiratory infection, we will have heat very often and phlegm. And so if we look at it from Eastern perspective, it's going to address that. It's going to tonify qi, especially in states of collapse, meaning severe disease. It clears heat. It helps dispel toxins. It dries dampness and relieves diarrhea if it's due to damp heat. The organs or the channels that it goes into are the lung, stomach, and small and large intestines. So from a Chinese perspective, we will look at the organ systems and whether there is heat or cold involved. This one, andrographis, from a D.A.C.M perspective, is going to be cold, and so it's going to address issues with heat. And the energetics, as we look at it, is that they're bitter and cold. With that being said, this particular herb, we want to make sure that we have warming soups or congee along with that, or that we occasionally take a break because it is cold. We don't like to enter too much cold into the body. Again, you do want to look for an andrographis that's standardized to at least 80 milligrams of the andrographylide. Boswellia. Many people know this as frankincense. The Western scientific name is Boswellia serrata. The Eastern name is Rougeon. From a Western perspective, it's going to work primarily through the 5-LOX inflammatory pathway. And no other medications can do this except for steroids. This is very important. This is going to address issues in which there is inflammation it's really hard to get to. It's useful for respiratory conditions, arthritis, GI conditions, and it's going to decrease pain and inflammation, as well as its anti-cancer benefits. It's often used in combination with the turmeric or curcumin for enhanced benefits. And you want to look for a Boswellia that has a higher ACPA content and a reduced BBA compound. And those are the pro-inflammatory compounds, BBA. So increased ACPA and decreased BBA. From a Eastern perspective, Rougeon helps to move the qi in cases of stagnation, and the category that it falls into is to regulate blood and invigorate blood. And often when we have inflammation, that's what we want to do, is increase the blood flow to reduce the inflammation. It's going to help with circulation, relieve swelling and pain, And this is something that's very unique about boswellia or rougeon, is that it assists with tissue regeneration. Organs of infinity are going to be heart, liver, and spleen. And the energetics are that it's acrid, bitter, and warm. So again, warming, help reduce inflammation. Red ginseng. Most people associate red ginseng or ren shen with Chinese medicine. The Western name is Panax ginseng, and it's a classic adaptogen. It contains ginsenosides. The noble and rare ginsenosides are more beneficial. It's going to be used in the Western perspective to increase energy and endurance. It may even help regulate cortisol throughout the hypothalamus and immune support, increasing the T and B cell production, and it's going to improve male sexual health. Conventional ginseng can be saturated with pesticides and herbicides, so you want to look for one that's hydroponically cultivated. And that's become a real issue with ginseng, and I do want to address this, is that because it is so beneficial, often the herbs are either going to be adulterated, or to keep them healthy to last a long time, to grow to the 6-year mark, which is usually when they harvest it, there are a lot of pesticides sprayed on the plants. And if you're going to ingest that, then you're going to also have those pesticides. So you want to look for a ginseng that is hydroponically cultivated so that you're not getting those pesticides associated with it. From an Eastern perspective, the ginseng, the reason it's red is because it's steamed, and when it's steamed, it's going to have that red color. So steamed ren shen, and that falls in the tonify herb and tonify qi category. Tonifying qi means that it's going to increase the energy, especially in the states of collapse. So when people are really tired, ren shen is going to be a benefit. It's going to tonify the spleen, the lung, and the blood, balances body fluids, and calms the shin. And when we talk about the shin, we're talking about the spirit. And the spirit is how you're feeling. So when you're under stress, you're tired, you need to have something that's going to be calming. So this is going to tonify the shin or the spirit. The organs of affinity are your lung and spleen, and also the heart. And the heart is associated with the shin, the stomach. It's going to help, and the energetics are sweet, warm, bitter, and moist. And this is a great, great herb that many people use, especially when we are tired. And it's used in both Eastern and Western medicine for that. Turmeric or curcumin. And this is one that is used and has been used for centuries. The Western scientific name is Curcuma longa, and the turmeric often only contains 2 to 5% of the active ingredient, which is curcumin. So the medicinal application requires curcumin. Curcumin is the medicine in turmeric. And this particular herb has been studied. There's over 11,000 published studies on curcumin alone. So this has been used for a number of different diseases. Curcumin has a number of uses, including anti-inflammatory, antioxidant, anti-cancer, liver protective, arthritis, pain, diabetes, and the list goes on. You want a curcumin that is not only just the herb itself, but in order for it to cross the nutrients, across the cell membrane, which is semi-permeable, you want to be able to have another carrier with it. So you want to have it enhanced with turmeric essential oil. That's preferred. The Eastern name is Jiang Huang, and it overcomes blood stasis to activate qi and shui. And shui is just another name for blood. It's the pinyin name for blood. And so the turmeric or curcumin is going to move qi and blood in the body. And often when we talk about blood stasis, I want to clarify this because often people don't know what blood stasis is. Anytime there's a blockage, remember I talked about the garden and the row being blocked. Well, if that area is blocked, it is called blood stasis. And so blood stasis is going to, we want to open that up. And when we open up that channel, reduce the blood stasis, you're going to activate the qi and blood together. So the improvement or the uses are improved circulation. You're going to dispel stasis, again, break up that blockage. You're going to relieve the pain by opening the channels, decreasing swelling. The organs of affinity are the spleen and liver. And the liver is going to help with blood. Energetics are that it's acrid, bitter, and warm. This is a very, very good herb for any type of inflammation and is often used in conjunction. We just talked about boswellia. It's often used in conjunction with boswellia because you can address the 5 LOX pathways as well as the COX-2 pathways so that you're getting kind of a 1-2 punch against any inflammatory issue. So that's what I've got. Do y'all have any questions?
Well, thank you so much, Dr. Barrows, for quite the informative presentation. And yes, indeed, we do have some questions that have come in.
Okay.
So let's get started on some of these questions. The first is, when you're talking about acupuncture, how does it help back pain and pain from arthritis if the pain is all throughout the body? I mean, it's not localized pain. What if you have arthritis in your knees and your hands and your hips? Can you use acupuncture, and how do you do that, and how long does the benefit of the acupuncture last?
Ooh, well, that last one's $1 million question. I'll address the first part of it. So if you've got pain all over your body, and it can be debilitating, acupuncture uses needles in a variety of places in the body. So we're going to use points first of all to address the pain. The very first thing we do is we open up the channels and we address the pain. Then depending upon where the pain is most, we're going to go to that area and we'll use acupuncture in that particular area. Once you begin to move the qi and the blood all over the body, it's going to help reduce the pain throughout the body. Now, how long does it take and how long does it last? Often the treatment is going to be unique to every individual. What we have found, and in my personal experience, is that initially the first treatment, it feels good for a day or so. And again, everybody's different, so I want to preface this by saying that. Then you have a second treatment, and the pain is reduced a little bit longer. Eventually, what we like to do is address the pain. It lasts longer and longer, and herbs are of benefit in this so that you're taking the herbs in between the treatments. And then eventually we want you to come in less and less, and eventually, which kind of sounds, goes against what the Western medicine is, but eventually we don't want to see you except for a tune-up, and that's ideal. So I hope that answered your question.
Here's another question that came in. Do you have any personal experience with treating someone with myofascial pain syndrome or trigeminal neuralgia?
Actually, I do. When I haven't had anyone in my current practice, but when I was in the clinic, I actually treated someone with trigeminal neuralgia, and that treatment it's so uncomfortable, and I'm sorry for anyone that goes through that. This person did find relief, and with the herbs and the treatment, we were eventually able to reduce the pain. The other experience that I've had is that my training is in neuro-acupuncture, and there is a husband and wife, Dr. pair in New Mexico, and they teach neuro-acupuncture, and they have a very high success rate for using neuro-acupuncture for trigeminal neuralgia. In fact, well documented. And their names are Dr. Linda Howe and Dr. Jason Howe, and they do very well. But any acupuncturist can treat it, but the neuro-acupuncture, the scalp acupuncture, is very good at treating that.
Thank you. Here's another question. Will acupuncture, and you had mentioned something about cartilage, will it help rebuild cartilage? If at all, is there anything available today that helps to rebuild cartilage?
Actually, the herbs are going to help in that category, and there are some supplements as well as herbs that help with that. What acupuncture does is to help reduce the pain and inflammation in that area. And often in those cases, we may use other modalities in conjunction with the acupuncture. So we may use moxibustion, we may use a far infrared light heat lamp with that. So there's a number of different modalities that help with the pain. But I can't say that acupuncture is going to rebuild the cartilage.
And another question, what is moxibustion?
Oh, moxibustion. I actually like moxibustion. Not everybody does. Moxibustion is where you burn an herb, and it is going to heat up, and the intensity of the heat you can direct locally, and it really goes in to give a nice warm sensation and heat up whatever channel is blocked. It also increases the yang, or the energy. I think that's why I like it so much, so I don't mind giving it. But it does have a very pungent odor when it is burned, so you have to make sure there's ventilation. But I've seen so many people with pain have benefit from utilizing the moxibustion.
So the herb is burned directly on the acupuncture needle?
It's kind of hard to explain without pictures, but often it looks like a fat pencil or a cigar, and you light the tip of it, and then you hold it close to the skin. You never touch the skin with it burning. So it's a very good question, but it often works like an incense, so you hold it around and you move that cigar around to heat up that particular area.
Another question that's come in, what's the difference between neuro and regular acupuncture?
Very good question. So neuro-acupuncture is going to follow the scalp, lines on the scalp, but also the channels on the scalp, but it also follows the brain patterns. So if we look at the brain and we look at the different fissures and sulcus in the brain has been mapped out to have certain areas of the brain in which you can put an acupuncture needle on the scalp, and it is near that particular area of the brain, and it will help with treatment. So often, for example, if we're looking at somebody that has numbness in their hands or their feet, we will not only use the acupuncture needles in that area, we will also follow what's called foot motor sensory on the scalp, and that often helps with that particular issue. Whereas acupuncture is all over the body. Still using the acupuncture needles, but the scalp or neuro-acupuncture is specifically on the head.
Another question, do you know anything about acupuncture with animals, dogs and horses, for example?
Yes, I do. I am not certified and specialized in acupuncture with animals, but my veterinarian is, and there are classes and there are veterinarians that actually have acupuncture, and they follow many of the same channels and the anatomy of the body, but it's been very beneficial for dogs with hip dysplasia that may have had some kind of traumatic injury. So acupuncture is quite beneficial for animals.
I'm just going through our chat boxes and Q&A boxes to make sure I haven't missed anything, but I think that we've answered all the questions. So thank you so much, Dr. Barrows, for taking time out of your busy schedule to help us learn more about acupuncture and all of the health benefits that arise from this kind of treatment.
Well, thank you for having me. I've certainly enjoyed it. I'm always excited about sharing the benefits of acupuncture.
Thank you so much. And thank you, everybody, for taking time out of your busy day to learn more about natural interventions for health. If you are interested in signing up for both Twitter or Facebook, you can find us at twitter.com/Terry Lemerand or facebook.com/Terry Talks Nutrition. If you are interested in listening to these webinars again or sharing them with others, this will be posted shortly, probably within the next day or two, to YouTube. There's a YouTube channel called Terry Talks Nutrition. Also, if you'd like to have a daily dose of natural medicine in your email inbox, you can sign up for a free weekly newsletter from Terry Talks Nutrition. We promise never to sell your information to other people. It's a great way to keep up on the latest and greatest in integrative health. So thank you, everyone, for learning more today about acupuncture. We hope you'll join us again for another Terry Talks Nutrition educational webinar. And until that time, good health to you. Bye-bye.